H.R. 3884. As the member designated by Ms. Lee pursuant to HRES 965, I inform the House that Ms. Lee will vote yes on H.R. 3884. As the member designated by Mr. Kennedy pursuant to HRES 965, I inform the House that Mr. Kennedy will vote yes on H.R. 3884. And as the member designated by Ms. Mang pursuant to HRES 965, I inform the House that Ms. Mang will vote yes on H.R. 3884.
Ms. May votes aye by proxy. Mr. Kennedy votes aye by proxy. Ms. Lee Havada votes aye by proxy. Ms. Pingree votes aye by proxy.
For what purpose does the gentlewoman from California rise?
Madam Speaker, as the member designated by Representative Brian Higgins of New York, pursuant to HRES 965, I inform the House that Mr. Higgins will vote aye on HR 3884.
Mr. Higgins of New York votes aye by proxy.
what purpose does the gentlewoman from Florida rise?
Madam Speaker, as the member designated by Mr. Hastings of Florida pursuant to HRES 965, I inform the House that Mr. Hastings will vote yea on HR 3884. And Madam Speaker, as the member designated by Ms. Mukersel Powell of Florida pursuant to HRES 965, I inform the House that Ms. Mukersel Powell will also vote yea on HR 3884. And Madam Speaker, as the member designated by Mr. Payne of New Jersey, I inform the House that Mr. Payne, pursuant to HRES 965, I inform the House that Mr. Payne will also vote yea on HR 3884.
Ms. Mukersel Powell votes aye by proxy. Mr. Hastings votes aye by proxy. Mr. Payne votes aye by proxy.
Does any member wish to change? On this vote, the yeas are 228, the nays are 164. The bill is passed. Without objection, the motion to reconsider is laid on the table.
Gentleman from Louisiana seek recognition.
Speaker, I ask unanimous consent to speak out of order for the purpose of inquiring to the Majority Leader the schedule for next week.
Without objection.
Thanks, and Mr. Speaker, I also ask unanimous consent to revise and extend my remarks.
Without objection.
With that, be happy to yield to my friend, the gentleman from Maryland, the Majority Leader of the House.
I thank the gentleman for yielding. Mr. Speaker, on Monday, the House will meet at 12 p.m. for legislative business. Members are advised that votes are expected as early as 2 p.m. I want to repeat that. We're going in at 12. Votes can be as early as 2 p.m. This is unusual for the first day of the week. I have advised and urged members to stay here this weekend. Most of them that I've talked to are, because clearly we are trying to get two critical pieces of legislation done, which we will speak to, I think, in a little bit. On Tuesday and Wednesday, the House will meet at 10 a.m. for morning hour debate and 12 p.m. for legislative business. On Thursday, the House will meet at 9 a.m. for legislative business. I want to advise members that we still have to pass an omnibus and we have to pass a COVID-19 relief bill. We will not adjourn the Congress until such time as we can accomplish those two objectives. I was hopeful that we would accomplish those objectives by next Thursday. Unfortunately, things are not moving as rapidly as I think they ought to. I'd like them to, but as they ought to be moving. So that members need to be advised that they need to keep their schedules very, very flexible until such time as we pass both of those pieces of legislation. We will, in addition, consider several bills under suspension of the rules. The complete list of suspensions will be announced by the close of business today. I want to say something further on suspensions. Somebody said, oh, well, we're not passing important bills. That's not accurate. Somehow, when we have agreement, it's not looked at as important. On suspensions, simply mean we have an agreement between the parties that we can pass those bills because they're bipartisan and the overwhelming majority of members agree on them. So we are passing bills that are good bills, but not controversial, and that's a good thing. And we will consider several bills on the suspensions. As I said, the complete list will be available at the close of business today. The House will consider the fiscal year 21 National Defense Authorization Act conference report. I am very pleased that we have a bipartisan, bicameral agreement on NDAA and look forward to overwhelmingly passing both chambers next week. And if necessary, overriding a threatened veto by President Trump. This is a critically important bill to pass. It always passes. And I am hopeful that we will come together on this bill. It was a tough conference, but a good conference. And the result, I think, can be supported by both sides of the aisle. Signed, obviously, by the Senate Republican chairman and our chairman here in the House. As members know, the current continuing resolution expires on December 11th. Therefore, the authority for spending to keep government running will expire on the 11th. The Appropriations Committee is hard at work on reaching an agreement on an omnibus, and I hope to bring that to the floor as early as possible. I'm hopeful that will be next week. Frankly, I've had a discussion with Senator McConnell. I've told him there is no agreement that we can not make on the 11th that will be easier to make on the 18th, which is the end of the following week. I would urge members, however, to ensure that they are available for the week of the 14th. If we have not completed our business by next week. The House may also consider additional legislation to address the coronavirus pandemic. As I've already said, the House has passed two different HEROES bills. Mr. Speaker, we passed a bill on May 15th, 6 months ago, to deal with this extraordinary crisis, placing millions of Americans at risk, causing deep emotional and physical distress, and a challenge not only to their health, but also their psychological welfare, and to educating our children and keeping our schools safe and providing the resources necessary that if we can get children back in school, which I think all of us want to do, that we can accomplish that objective. The House has also passed on October 1, some 2 months ago, a $2.2 trillion bill. That was not taken up by the Senate. The Senate has passed no legislation since May 15th. They did not consider our bill either time, either the Heroes 1 bill or the Heroes 2. It's unfortunate in my view that Senate Republicans have failed to act, even if they didn't act on what we wanted to do. I'm pleased that the Speaker and Senate Majority Leader spoke yesterday. I've spoken to him 3 times this week, and I hope that we can get an agreement. The House stands ready to act next week. Lastly, as everybody understands, when you get to the end of a session, we don't contemplate everything that might be on the agenda, so that other pieces of legislation may be on the agenda next week or the week thereafter. Again, I want to reiterate, I am very hopeful that we could get this business done by next week. The reason I scheduled, Mr. Speaker, the 11th as the CR day is because I wanted to make sure we could get members home. The COVID crisis, the pandemic has exploded. Members ought to be not aggregating here on the House floor or aggregating in Washington. They ought to be home. And if we got out on the 11th, I want to get through on the 10th so we can send a bill to the Senate. However, if we left on the 11th, it will be 14 days before Christmas. And therefore, if members leaving Washington had to quarantine themselves, they would have sufficient time to do so that they could be with their families on Christmas Day. I would hope that everyone on the Appropriations Committee, the leadership, myself included, would feel the urgency of passing this needed legislation. And I thank the gentleman for yielding.
Thank the gentleman. And a few of the items relating to legislation that I want to bring up with the gentleman. But before that, I did want to mention that it's my understanding that the floor director for the Majority Leader, Ms. Shawanza Goff, last thing I'd want to do is embarrass her here on the House floor, but it's my understanding she may be leaving. And if I can just first say—
It is a vicious rumor that has been spread abroad in the country.
And I'll be happy to yield time to her if she'd like to deny that rumor. But while that may create some issues, I would like to say that if this is the last time that we do this colloquy before the end of this year, it's been a true pleasure to work with Shawanza Goff. My whole staff has enjoyed working with her, and especially on those areas where we agree. The CARES Act and USMCA come to mind as recent major accomplishments that this legislative body has done together, Republicans and Democrats. And she, I know, has been that conduit who works with our staff on the Republican side, and we've considered it a true joy to work with her. She doesn't schedule every bill I ask her to schedule, but I'll blame that on the Majority Leader, not on Shawanza. But if I can, in all seriousness, say that it's truly been a treat and a joy, and she's one of the people that makes this place work when it does work. You know, we can always talk about the things that we would like to achieve that we can't, but there are many important things we achieve, like those pieces of legislation I talked about and many others that don't get that same kind of attention, but they wouldn't happen without the work and the great leadership that Shawanza's demonstrated here. She will be missed here, but I just wanted to mention that, and I know the gentleman feels probably even stronger because she's worked for you, I think, for the whole time I've been in leadership, but I think going back to maybe 2008, and I would yield back.
So the gentleman yield?
I would yield to the gentleman.
I may get into this next week, and I'm hopeful the gentleman is right that we don't have a colloquy next week, that we will have completed our business as I've been talking about. But I have been blessed. The House has been blessed. The country has been blessed by Schwanzikoff's leadership on this floor on my behalf and on the majority's behalf, working closely with the minority. And I know that Schwanza would want me to say that she looks forward to the same kind of cooperation in her new job that she's gotten in her old job. And if the gentleman wants to assure of that, I will yield to him.
I'll give this assurance to the majority leader that if you're looking for replacement, I'll be happy to provide recommendations and even participate in the interview process if that would be helpful to the gentleman from
The
Maryland.
gentleman is most generous.
I think the generosity probably ends there with today's colloquy. I'm sure we'll have that opportunity next week to have a longer conversation, but truly do want to pass that on to Schwanza and not just on behalf of myself, on behalf of the minority leader, Mr. McCarthy, his staff, as well as mine and all of us in leadership who get to work with her. With that, I do want to mention on the schedule next week, one of the items that I know we've worked on together and talked about that I believe the gentleman has scheduled for next week is S578, which is the ALS Disability Insurance Access Act, something that we've worked on a number of these items for people with ALS. The Steve Gleason Act was one of those items we worked on a few years ago, passed to help people with ALS, and has been a tremendous, tremendous benefit to people struggling with ALS. Steve Gleason is a constituent and a dear friend, somebody who we've worked with on many things. He received earlier this year, it seems like years ago, but just January of this year, was the recipient of the Congressional Gold Medal, and deservedly so. But he and I were communicating earlier this week about this legislation, which I'm a co-sponsor of. And I just want to thank the gentleman for scheduling that for the floor next week. One of those areas, as you were talking about earlier, might not get a lot of attention, but an issue that both Republicans and Democrats have worked on to help people with ALS who right now, under current law, even after the diagnosis with ALS, as we know, is just a devastating diagnosis, have to wait 5 months to get the normal benefits that they are entitled to. And time is very, very critical to people with ALS. And this eliminates that 5-month gap where they would have to act, one of those additional occasions where it takes an act of Congress to fix this. And the Senate acted, and quickly now the House will be acting to address this deficiency that needs to be fixed. I think you will see both sides come together with a very large vote, but I want to thank the gentleman for scheduling that for the floor next week. And I would yield if he had anything to add on that.
Well, I was pleased to schedule this. Obviously, as you know, it's passed the Senate the other day. And hopefully we will pass it on suspension next week, and it will be sent to the president. Hopefully the president will sign it. Obviously, ALS is just a terrible, terrible disease, and a disease that acts very, very quickly, which meant that there's a premium on the government's response to assisting people with ALS be quick as well. And as we know, what this bill does, it provides for an acceleration for people who are suffering from and afflicted with ALS to get assistance. So hopefully the House will pass it and we'll send it to the president. And I appreciate the gentleman's co-sponsorship of the bill. I yield.
Thank the gentleman for yielding. As it relates to the schedule next week, as well as the schedule we've had this week, want to bring up a piece of legislation that we've talked about here at this colloquy and in other venues for months now, and that is the bill by Congressman Shabbat, H.R. 8265, which is the Paycheck Protection Program Extension Act. We've seen over these last few months, our small businesses have struggled tremendously. Some industries have done better during this pandemic, where they've seen increased sales for various reasons, but we've mostly seen and heard from so many of those businesses and industries that have been devastated. Some harder than others, but so many devastated to the point of bankruptcy. Daily, we see stories of businesses that close their doors for good. In the state of New York alone, it was reported that 1/3 of all small businesses, 1/3, will never open again. And when we came together to do the CARES Act, to pass that lifeline to so many small businesses, saved probably 50 million jobs in America, saved millions of small businesses, but it expired. And when it expired, we learned a lot more about where our economy was at that time. When we passed it, it was at the very beginning of the pandemic. We now saw over those months which businesses were doing better, which weren't, and came back in September with a piece of legislation that would free up money that's not going to have to be borrowed, money that's actually sitting in that account frozen, $137 billion that we already appropriated, but the program expired, so it can't be used anymore unless we change the law. So we're not talking about creating a new program. We're talking about going back to a program that was maybe one of the most successful things that we've done to help people in need. Not just those small businesses, but the millions, 50 plus million people whose livelihoods depend on those jobs. And the bill was brought forward, had a lot of bipartisan interest, but for various reasons hasn't been scheduled on this House floor. And there were reports that maybe it was tied to waiting on the election or whatever other things. In fact, the Speaker of the House just today made a comment that one of the reasons that bill, a certain relief package bill, wasn't brought to the House floor is because she was waiting on, quote, a new president. I hope that was a quote that was made out of context or maybe needs to be revised. But there are millions of people that are literally facing the elimination of their livelihoods. And we have a bill that if it was put on the floor today, yesterday, September, when we first had this conversation, there would be hundreds of thousands of businesses still open today that are now bankrupt, that will never open again. Every day we wait, more businesses don't reopen. Clearly, we are negotiating to try to get an agreement on bigger issues. We're not there. We weren't there last month. We weren't there the month before. The Senate's tried to take up votes on things. It wasn't the Republicans. It was the Democrats that blocked those bills from coming up. This, by the way, was one of those in the package that would have been voted on by the Senate, if not for Senate Democrats blocking even the debate on the Senate floor. So they never had that debate. On this floor, just today, we saw a bill to legalize marijuana. You saw items in there where it would give additional money to people in the marijuana industry. Now, this is something that Congress, I'm sure, will continue to debate, but there's a pandemic where today we have businesses that are shutting their doors. Tomorrow, businesses will go bankrupt forever. Small businesses, and we can help them. Not with a new program that we need to negotiate the details over, but something we already did that was so highly successful that we have a track record to show what it can do. Our small banks, local community banks were part of that process and are ready to go again. Again, we don't need to reinvent the wheel here. This is an existing program that has got existing remaining money, but the program is frozen and expired, and this bill just renews it and could pass on the suspension calendar and still hasn't been brought up. And while we're negotiating other things, why not release this hostage and let this bill pass? It could have been done today. It wasn't a lack of time. When we're debating legalizing marijuana instead of saving small businesses, that is a misplaced priority of this Congress. We should have come together months ago. September 16th, it was introduced. September 17th, I brought it up to the majority leader at this colloquy. The following week, brought it up again. And then we filed a discharge petition. You had, I think, 23 Democrats sign a letter saying that they would sign that discharge petition if we didn't get a bipartisan agreement, recognizing that the HEROES Act is not a bipartisan agreement. Unfortunately, not one of those members who signed the letter saying that they would sign the discharge have signed the discharge. Talk is cheap around here. Livelihoods are being lost. Businesses are shuttering for good. Why can't this bill be scheduled for the floor? While we work on the other things that we're not in agreement on, this is something we're in agreement on. But it won't be scheduled for the floor. Maybe we can get an agreement to schedule that Monday when we're coming in at 2 o'clock to vote on other items. This would be something that would get 400 plus votes if it was just scheduled. And I would yield to the gentleman.
I thank the gentleman for his observations. He is right. We're for this. We're also for making sure that children have food on their tables. We're also supportive of making sure that education facilities have the money to keep their venues safe and to keep education flowing. We're also for making sure that childcare is available to parents who can go back to work when and if their children go back to school. We're also for having critical money for testing and tracing, and yes, for delivering the vaccination. And yes, we're for that, and we're also for states and localities that are hemorrhaging revenue have the resources to continue to be on the front line of fighting the battle against COVID-19. And we are also for resources, not only to have created the vaccine, which almost all of which is being funded by the federal government, we are also for making sure we can deliver that vaccine and have a vaccination as well as having a vaccine. We are for very strongly the extraordinary number of helping the extraordinary number of unemployed who are on unemployment insurance and who at the end of this month they're going to find it goes away. And we're for having an additional enhancement of that unemployment insurance, which so many economists will tell you from the CARES bill was absolutely essential to keep the economy afloat. And the fact that we have kept the economy afloat is shown by apparently the stock market thinks we're okay, but the millions and millions and millions of families who are in deep distress are not okay. I am appalled by the fact that we have not acted. We've acted twice. You say it wasn't partisan. That's true. You chose not to vote for it. It wasn't much different than the CARES bill, which you did vote for. But apparently, shortly after we passed the HEROES bill, your leader, Mr. McCarthy, said, let's wait and see what happens. And Senator McConnell said, let the states go bankrupt. Well, they're on that road. And we've seen what happened by waiting. We have thousands of our fellow citizens dying every week. Thousands. Now over 260,000 Americans. Millions afflicted. So I tell my friend, Mr. Speaker, that we care about PPP and we took care of it in both bills we passed. Now, it wasn't a question that they were partisan or not partisan. They weren't taken up in the United States Senate. We passed them. They were not taken up. Yes, the Senate leader offered a bill that every economist with whom I've talked said was not substantive enough, not sufficient resources to stop the hemorrhaging and to help fight COVID-19. So I tell my friend, we're for that bill. What we're not for is forgetting the kids, the families, the hospital workers, the researchers, the states, the localities. We're not for forgetting them. And we believe that if we pass one part of a multifaceted response to COVID-19 and the implication for our economy, that will not be what our economy nor our people need. So we would ask you to talk to the Senate or to offer your own bill. Offer your own bill. Offer your own bill that deals with all of those millions of people that I just referenced that are in deep, deep distress. Because we need to deal with the small businesses, and we do. We need to deal with the unemployed, and we knew. We have a lot of things expiring on December 31st. PPP, your bill does not deal with any of that. We need to deal with all of it. We ought to do it. And that ought to be, Mr. Shavitz's bill ought to be a part of that. And it will be, because we're committed to that. But we're also committed to not forgetting all of those people and elements that I mentioned. I want to help the airlines. And hopefully that will be in any deal that we come to. I want to help the restaurants. These are people who are, through no fault of their own, devastated. So I tell my friend, he is right, but only partially so. He is right that we ought to be helping the small business. But I don't think there's a small businessman in America that would say, let the nutrition issue go. As we see lines of cars and lines of people getting food boxes so they can put food on their table for their kids and themselves. People who would never, ever expect in their lives to be in a food line. I think the small business would say, take care of them. I think the small businessman would say, you know, I haven't been able to pay taxes, and I know the state's still operating, hospitals is still operating, fixing the roads, it's still hiring police and fire, it's hiring nurses in public hospitals. They need help too. And we're all in this together. So that's my response to the gentleman, Mr. Speaker. We want to have a comprehensive bill that will deal with a comprehensive threat to our economy and to the health of our people and to the welfare of our people. We think that's the responsible thing to do. So I'm hopeful that we can get an agreement in the near term. And when I say the near term, by next week. And I've been talking to Senator McConnell towards that end. The Speaker is talking to Senator McConnell towards that end. Senators are working on an effort to get that done. I'm hopeful they're successful. Speaker and Mr. Schumer said it was a place that they could negotiate from, which means we're closer than we have been, and I hope it gets done. I yield my time.
Let me remind the gentleman that in the CARES Act, we addressed many of those issues that the gentleman already brought up, starting with the states. In fact, I don't know of a single state in this country who has spent all the money we sent them. Educational opportunities for schools to reopen safely and educate kids are being denied in some places, but not in others. But it's not from a lack of money. There's not a single school system I've heard from who says, my state where we sent them the money, and by the way, they've still got millions and in some cases billions of those dollars sitting in their account, idle, that can be used today to safely reopen schools. If the state chooses not to do it, or if the school system chooses not to do it, that's on them. But they're denying those kids opportunities. And we're seeing report after report, scientific studies, the American Academy of Pediatrics, talking about the damage that's being done to our young children by being denied the opportunity to go back to school in classroom and learn. It's devastating to those kids. Suicides are up. Opioid abuse is up because of all of these things. And it's the small businesses who are paying the biggest price. And so if you look, people that are getting unemployment insurance at the state level, we did enhanced uninsurance for a period of time. And in most cases, we were paying people more money not to work than they were making before they lost their job. What they ask me is not that they want to stay on unemployment. They want to go back to work. They want their business to be alive when they go back to work. But if a small business closes for good, the cost to us is going to be dramatically higher. If we can right now throw that lifeline again to those businesses, not with a new program, not with things that we don't agree on, like $900 billion to bail out failed states, which is the HEROES Act. We already spent hundreds of billions of dollars that we gave to states. And like I said, I think every single state still has some of that money left. Some have billions of dollars of that money left. So the idea that we're going to hold up relief to small businesses who are closing every day, hundreds of thousands, a third of every small business in the state of New York are gone for good. How many more need to die before this problem is recognized by this Congress? So those states are sitting on money, and the gentleman wants to hold up their relief for the small businesses to give another $900 billion to bail out states, not for the COVID damage, but for the problems they had before. That was what the HEROES Act disagreement was about. We agreed on giving states money. They still have some of that money, and it can be used to reopen schools safely still today. What is not there right now is relief for those small businesses. And so when you look at all of these different things, the vaccine, They're not waiting on approving a vaccine based on more money coming in. We put money in the CARES Act, and President Trump spent it effectively on Operation Warp Speed to get us to a point now where we have two, not one, but two major Pfizer, Moderna, ready to go. FDA is about to approve two different vaccines, and it's being mass produced today. We're not waiting on money to mass produce it. The Defense Department is actually involved in helping distribute it. Airlines have already been contracted to get it out. Some need to be air conditioned more than others. All that's put in place. If we need more money, we'll come together and get more money, but a vaccine is not waiting on us to send them more money. We need to get it out. We need the FDA to follow their process, which they're doing. They're the gold standard in the world for approving vaccines, and it's unheard of in the history of mankind for a virus that we didn't even know of until a year and 2 days ago in the world to now be on the brink of not one, but two FDA-approved vaccines. That's happening because of what we did coming together with the CARES Act and then President Trump's Operation Warp Speed. So these aren't items that are waiting on our relief. What is waiting is relief for small businesses. Now, the HEROES Act, again, it was a partisan exercise, not because it was mostly like the CARES Act. It was very different from the CARES Act. In the HEROES Act, there are billions of dollars in that bill to give checks to people here illegally. That wasn't part of any agreement, wasn't in the CARES Act. That's new policy that's not going to be signed into law. And if you want to negotiate and hold small businesses hostage on that, we may never get relief for small businesses. But that was one of the items in the HEROES Act where we had no agreement. But the areas where we had agreement, can we at least agree to pass the things we have agreement on? And what did we have more agreement on than anything is the PPP, proven to be so successful that literally every day we hear from small businesses who say they wouldn't be alive today if not for the PPP. But we also hear from small businesses every day who are about to close. As some states are talking about shutting their whole state down again. Their whole state down again. We know that's going to lead to businesses that will never come back. And we have a bill ready to go that would get massive bipartisan support without a new dime of money sitting and frozen in an account that would help those small businesses. The criteria is you had to have at least 25% loss. So your small businesses that are doing well today, and again, we know there's some that are doing better today than they were a year ago, but we also know some that are about to close for good, and we can help them. Not with new policy that we're not in agreement on. That's where the negotiations are continuing to go back and forth on. But if there's something we all agree on, do we really need to hold that hostage when that means that many of those businesses will never come back? This isn't something, we could have done this in September. It was brought up in September. It's not a new item. How many thousands of businesses died from the day that that bill was introduced to today and will die again between now and Monday? It can be put on the schedule Monday. It's not going to stop the negotiations on the other things. There are other things that we're both in agreement on that aren't part of that bill. Bring that as a standalone. Let's bring each of those items that we're not in agreement on. But the idea that we hold everything hostage to things that aren't going to happen, hundreds of billions to failed states, giving checks to people that aren't here illegally, is that really a priority? Is that really the things we're getting called on every day? The folks that are on unemployment want to be able to go back to their job. And if the company is dead and gone, there will be nothing to go back to. And so we're working on so many items that we're in agreement on. We've given money to our health experts to continue to focus on the virus, to continue to get the vaccine. And we may have another 2, could be 4 vaccines by the end of this year. And that's what we all ought to applaud because of what we did when we came together. But here's an area where we already came together and it was so successful that that money now is frozen. And those businesses that did well are still doing well. The ones that aren't will or will not be alive in a month from now based on whether or not we confront this. It's not new policy. It's something we already agreed on and something we already celebrated as a success. Let's do that one more time while we negotiate on the things we're in disagreement with. I would just suggest that and yield to the gentleman.
Well, I thank the gentleman for suggesting that. I didn't hear him talking about the children who are having trouble getting food on their tables every morning and every evening. I didn't hear him talking about the unemployed, 12 million American workers who are going to run out of unemployment as of the end of this month. I didn't hear about him. I did hear him talk about, Mr. Speaker, the failed states. And let me tell you, Maryland's not a failed state. And our governor is a Republican. His name is Hogan. His father served in this body. He, along with Mr. Cuomo, the governor of New York, said the states, meaning all the states, need a substantial assistance or they're going to have to make substantial cuts. And in my state, we have made cuts. And we're a wealthy state. We've made cuts which have undermined the state's ability to respond as robustly as they need to do to COVID-19. Now, the president wants to talk about failed states. What he really means is blue states, Mr. Speaker. That's what he means. Large states like New York, large states like California. But by the way, Florida and Texas are in the same position. Now, Texas has a greater surplus. But failed states is a fake news item, Mr. Speaker. What we should do is come together and have an agreement. Now, we can pass something here, and we did pass something here. The Republicans chose to join us, Mr. Speaker, on the first three bills. One was a $8.3 billion bill responding to $1.2 trillion or $2.2 trillion that the president asked for. In other words, 4 times as much as the president asked for. Now, in terms of what we've done, that seems like small potatoes. A lot of money. But it was clear that the administration's response to this crisis was woefully inadequate, represented by that first bill that they sent to us, knowing full well that it would not even come close to meeting the needs. Well, so we've increased it about 400%. And then we negotiated. The Speaker negotiated with Mr. Mnuchin and came up with 2 additional bills that were passed in a bipartisan fashion. And very frankly, the president told us this was about to go away. Not to worry. It's going to go away. It'll go away tomorrow maybe, or next week. It's going to go away when the weather gets warm. And Mr. Fauci, Dr. Fauci, said, no, Mr. President, that won't happen. And so essentially the president dismissed Mr. Fauci, Dr. Fauci, as a principal advisor. Thankfully, Mr. Biden, President-elect Biden, is going to bring him back as the principal advisor. One of the great experts in the world on vaccines and on infectious diseases. So I'm somewhat frustrated that we focus on one facet. But I will tell you, if those 12 million people become unemployed without additional assistance, they won't have any money to spend on small businesses. If those states don't have an ability to operate properly, that will hurt small businesses. If the transportation systems falter, it'll hurt small businesses. But my point is, Mr. Speaker, that we are, e pluribus unum, out of many one. We are a nation reliant upon one another, and the harm to one results in the harm to the other. And therefore, we believe that there ought to be a comprehensive piece of legislation, as there was overwhelmingly supported. But the Republicans, after CARES, and when we passed the HEROES Act in May, passed it on May 15th, they thought everything was hunky-dory and they walked away. Mr. McConnell said the state's going to go bankrupt. Think of what that would have had, the consequence that would have had. And yes, we gave them some money under CARES. Nobody, when we voted on CARES, thought we would be where we are today. Nobody. Except Dr. Fauci and some other experts, scientists, medical personnel said, look, this thing's going to come back, because that's what happens with these pandemics. They have original assault, then they come back. And they came back with a vengeance. And people are losing their lives. and the failure to pass a comprehensive bill. We agree. We want to help these small businesses. And Heroes 1 helped small businesses. Heroes 2, you didn't vote for those. You said they were partisan. I'm not sure what was partisan about them. They were no more partisan than the CARES Act was partisan. The difference was, very frankly, Mr. Speaker, the Republicans decided they were going to vote for CARES. And then they decided, we've done enough. And we've been twisting in the wind now for 6 months since we passed Heroes. I don't want to make a speculation of how many hundreds of thousands or tens of thousands of lives may have been saved had we passed Heroes 1. Or we'd acted much sooner out of the administration. But I'm hopeful we can get rid of all this, who struck John, you did it, I did it, who did it, and come to grips in the next 7 days, maybe 14 days, but 7 days. There's no reason why we can't come to an agreement. There's a bipartisan group in the United States Senate, Republicans and Democrats, have come up with a bill, $908 billion. Now, that's a lot of money. But what they try to do is deal with all of the issues that I've raised. And they do. Maybe not as much as I think we ought to do, maybe not as specifically targeted as I think, but it is a basis for agreement. And I hope the Senate passes it. I hope they pass it next week and send it over to us. And I guarantee you, when they send it over to us, we'll act on it. We won't leave it sit as Heroes 1 and Heroes 2 have sat in the Senate for 6 months or 2.5 months. We won't let it sit. Why? Because the country is at risk. Our people are at risk. Our children are at risk. Our families are at risk. And as you so correctly point out, Mr. Speaker, the whip points out that our businesses are at risk. He's absolutely right, and we need to act. But if we only act on small businesses and we don't take care of the other problems, the small businesses ultimately will not be able to survive either. We're in this together. We do not have a policy on this side of the aisle saying, you're on your own, children. You're on your own, unemployed. You're on your own, states, localities, municipalities, small towns, small counties. You're on your own. That's not our policy. We're in this together, and we want to help all of those in distress. So I don't know that I'll have anything more to say on this particular item, but I am appreciative of Mr. Shabbat's bill. I hope that his bill is included, and I hope that we can pass something next week to help all of those in deep distress. That would be good for our country. It's the right thing to do. It's the moral thing to do, and I hope we do it. And I will facilitate it when we get to an agreement. I thank the gentleman.
And I thank the gentleman too. In terms of our children, we know sending them back to school safely, the protocols are out there. Child nutrition programs are administered in our schools. That's not happening because the kids are in those systems where they're not safely reopened. Those kids aren't able to get the school lunch
Would the
program.
gentleman yield on that point?
I absolutely would.
I don't know about your school system, but my school system is still providing for meals for kids, either as a pickup at the school or delivery at some site. So, because that is a critical problem, but they need money to do that. And we know that food banks are stretched, and we need to deal with that program. That's my point. It's not just small business, it's that nutrition program. But I just wanted to clarify that in my school districts, we are delivering meals, notwithstanding the fact that the schools are shut down. And let me say something else just as an aside. 3 of my counties have a majority, if not unanimous, county commissioners who are all Republican. They have all voted to keep the school systems virtual, as have my other counties. I represent 5 counties, essentially, or parts thereof. They've all voted, hearing from parents and teachers and perhaps some students, they're all virtual. they'll need as much money to continue virtuality as they will to get kids back in school. They need extra resources to do that. And the $908 billion bill that's agreed upon or not proposed by a bipartisan group has money in that bill for those programs. I yield.
But those schools already have access to the $150 billion we already sent to states that they haven't even already spent. If I gave you money to do something and you haven't even used all that money, you can't use that as an excuse for not doing it and saying, I'm waiting for you to give me more money when you still have money remaining. And I agree with the gentleman on the school lunch program. The thing is, we don't give a supplement to schools in normal times. These are not normal times, but in normal times, schools feed kids at lunch with the existing budgets they have. They don't wait for us to send extra money to them to feed the kids. If they're not educating the kids in the classroom, they're still taking that money. I haven't seen them rebate the money to those families in those communities. So what are they doing with that money? And so if there's money, if you bring the kids back and educate them safely in the classroom, which the protocols allow for in any community, high risk, low risk, if you've got a high outbreak, there's different ways to handle each community. CDC has given that guidelines. Academy of Pediatrics have given the guidelines. Some school systems have just chosen not to follow them and then to leave the kids at home. But they're still taking the money. If there's never been a better argument for school choice and letting parents choose, if one school system's willing to educate your kids safely and others not, why shouldn't you be able to take that money and send your kid to the place that's willing to do it safely for you? So it's not a question of the money. It's a question of the will to do it. But when we talk about those businesses and what was in the CARES Act and what wasn't, the CARES Act was not the HEROES Act. I think the gentleman knows some of the differences. I'll tell the gentleman a few of the differences. What is in the HEROES Act that's not in the CARES Act that we all voted for was letting thousands, an unknown number of thousands of criminals out of prison. I've never gotten a straight answer on how many thousands of criminals would be let out of prison or why that even needs to be in a COVID relief package. But that's in the HEROES Act, which is not in the CARES Act, and we are completely in disagreement on that. Why it hasn't been dropped out, who knows? But that's a choice the majority made. Again, sending direct checks, billions of dollars in direct checks to people that are here illegally was not in the CARES Act. It is in the HEROES Act. If we wanted to make it bipartisan, drop those things out. But they haven't been dropped out by the majority. And here we have a program that we agree on. But in terms of the small businesses are dying on the vine because some states are giving mixed signals, changing rules, going backward, forward. In states like California, they're saying you can operate as a liquor store or as a strip club, but not as a church. Even the Supreme Court stepped in and said that's ludicrous and you can't keep doing it. But then you go to New York and you go to so many of these states where they're saying, oh, for safety protocols, you got to shut down. You can't go to a restaurant. And then you see the governor of the state at a restaurant without a mask, but you can't go. You see mayors in communities telling businesses they can't stay open, or it's not safe to have Thanksgiving with your family, and you find out they're flying to other states to have Thanksgiving with their family. So this blatant hypocrisy by some of these leaders who are telling you that you've got to live your life one way and they're living their lives a different way and hiding behind protocols that don't exist, that's driving people nuts. The businesses are dying because of it. But the trust in government gets depleted in those places because they're watching it. It's not isolated. I wish it was just once or twice. I wish it was never going on. But it's over and over again. Yesterday and today, another story comes out of a local leader or a governor telling you you can't do something, and they're doing it. They didn't think they were going to get caught doing it. My God, that's got to end. The hypocrisy has to end. And let's get back to saying things that make sense. Working with the protocols, working with the experts and the scientists. But don't use a scientist selectively and say something that's not really true. And you yourself know it's not true because you're doing it. That's what some of those folks are doing. It's driving people nuts and it's driving their businesses under. They will never come back. Those families that are struggling, the kids that are going to have trouble eating are having that trouble because the businesses that their families work for are being bankrupted by crazy radical policies that have to end. We can help them in the short term. We ought to help them in the short term. Some of the stuff I mentioned that we're not in agreement on ought to get dropped out. But in the meantime, don't hold them hostage. Let's bring those things that we agree on to the floor and save the businesses that we can, because every day we don't, more will never come back. I would yield it the gentleman had anything else.
Well, I just want to say, this business about illegals getting money. Let me just give you an example. You have a husband and a wife and 3 children living in an apartment. The husband does not have authorization to be here. And what the bill provided that the gentleman talks about is making sure we feed those children, even though somebody that's illegal is living in the household. What they would have done is nobody in that household got help. It's just a difference of perspective. And I get it. But let me tell you something. What you can't get away from is, Mr. Speaker, they have not passed a bill through the United States Senate. Why? Because it would require compromise. Because you don't have the votes, Mr. Speaker, by the Republican Party to pass a bill without compromise. So they have sent us no bill. Now, Mr. McConnell can say all he wants. Well, we need 60 votes, and they won't give us 60 votes. He's right. And he won't compromise. Your
Afternoon, everyone. Eric, let's go first to the data for today. Today, we're reporting 10,114 new cases. That is our highest number in over a week and our 4th highest ever. Our 7-day average of reported cases is now 8,165. So this is above our last 7-day average by about 2,000. Hospital admissions, we're reporting 392. Our 7-day average is 388, so it's about the same. Today's the 3rd highest day for deaths reported at 129. Again, we will point out that these are not deaths that have occurred today, but ones that have occurred in the recent days, and that we find out about them in the last 24 hours. Our 7-day average for deaths reported is 77. We'll now go to Dr. Bruce Vanderhoff, our Chief Medical Officer at the Health Department. Bruce, thank you for joining us. He's going to explain new guidelines for quarantining after exposure to someone with COVID-19. Dr. Vanderhoff.
Thank you, Governor. Quarantining after we've been exposed to COVID-19 is very important. It's very important for helping to control the spread of this virus, which, as we know, is raging through our communities. But quarantine only works when we actually stick with it. Knowing this, and knowing how hard it is to quarantine for 14 days, the Centers for Disease Control and Prevention has been carefully evaluating emerging data. That and our growing confidence in testing has allowed them to offer 2 new options for quarantining that will be reasonable for many Ohioans. A 10-day option that does not require testing, provided there are no symptoms, and a 7-day option with a negative test, again, provided there are no symptoms. We ask people to quarantine, that is to stay in their homes, after they've had close contact with someone who has COVID-19 to help prevent further spread of the disease. Because as we know, it can be carried and transmitted by people even if they never show symptoms. Now, I want to be clear. Staying at home for 14 days after contact is still the safest way to limit possible spread of COVID-19. And we continue to recommend this for people who might be in settings in which COVID-19 is at risk of spreading extensively. But for others with no symptoms, the 10-day or a 7-day period may be appropriate based on circumstances or guidance from their local health department. This may, for example, be a reasonable option for many in a classroom setting where distancing and masking are being consistently applied. But in every case, whether quarantining for 10 days or 14 or 7, maintaining a physical distance of at least 6 feet, wearing a mask when around others are vitally important. Keep an eye out for any symptoms for the full 14-day period, regardless of which option you are participating in. And if you become sick or test positive for COVID-19, well, then you need to stay home and self-isolate. And that means staying at home and in a separate room from others. Now, I can't emphasize enough how important it is to comply with quarantine guidance whenever we've had a potential COVID-19 exposure. That's why these enhanced quarantine guidelines are so important. They strengthen our quarantine guidance at a critical time in this pandemic by reducing the burden of quarantine to improve compliance. I want to reiterate, we understand that quarantine can be difficult. It can be difficult financially, socially, and for mental health reasons. But there is no question that it can help us reduce the transmission of this disease. When you quarantine, you are protecting your community and fighting alongside all Ohioans to reduce the threat of COVID-19 to our lives and to our livelihoods.
So, Dr. Vanderhoff, thank you very much. So in summary, this is guidance from CDC. This is now guidance from the state health department, which goes out to the local health departments. And summarize again the ultimate objective in making this change. What does CDC hope to accomplish? What does the state health department hope to accomplish?
Thank you, Governor. Both the CDC and the state health department have recognized how burdensome that 14-day quarantine period is for so many. And now we have much more scientific evidence that we can rely upon that says, well, for many people in the state, 10 days without a test or 7 days with a test is going to do a very good job. And because it's easier to comply with, it's going to be a better outcome. More people are going to be able to stick with it. And therefore, we're now offering that alongside the CDC as an option for most Ohioans.
So one hope would be more people likely to comply, more people likely to do this.
That's right. The harder the hill is to climb, the fewer people are going to do it.
Okay.
We're trying to lower that hill.
All right. Very good. Let's turn to vaccines. We've been working with the federal government on this. I had a conversation a couple hours ago with the vice president about this, and we continue to learn more, and this continues to be fine-tuned, and this will be a work in progress. This is not something that we're going to set it and it's just going to go. It's going to be continued to be fine-tuned. But let me repeat what the main objectives are. I think these are the same objectives we have as the federal government has, and I think it's the kind of universal objectives. One is to save lives, to cover the most vulnerable people as quickly as we can, people who are in a situation where they're more likely to get it, and if they do get it, or more likely not to have good outcomes. The second is to slow the spread of the virus. And third objective, one more certainly, is to make sure that our healthcare workers, those people who are on the front line, risking their lives, and those people who we rely on, not just for help with COVID patients, but with others, that they are able to do their jobs and that we can do everything that we can to keep them safe. So as we look at the objectives, we'll be starting, we hope, the middle of this month in phase 1A. The priorities that we have set are consistent with the priorities that have been given by the CDC. And I want to go through these in just a general description. There may certainly be different groups that have been left out, but I'm trying to give you all an understanding of how this is going to work. As we begin phase 1 of the vaccine distribution, we hope that is around December 15th. The following are the priorities. And these are priorities not in order. They're all the priorities that we will be working to get the vaccine out to just as quickly as we can. Healthcare workers and personnel who are involved in the care of COVID-19 patients. Read again, healthcare workers and personnel who are involved in the care of COVID-19 patients. EMS responders. It's a second group. Then we come to a series that I'm going to read to you of different groups, but they really all come under this definition. And that is that we will prioritize vulnerable individuals who live together in close proximity and those who care for them. Vulnerable individuals who live together in close proximity and those who care for them. These are the ones that we have found. These are the ones who we have found to be the most vulnerable. This would include residents and staff at nursing homes, residents and staff at assisted living facilities, patients and staff at state psychiatric hospitals, people with intellectual disabilities and those with mental illness who live in group homes or centers and staff at those locations, residents and staff at our 2 homes for Ohio veterans. So these would be examples of individuals who will be in Group 1A. Now, we are still waiting for confirmation, firm confirmation about what will be sent out in the month of December. So we can give you what we believe these numbers are. And I'll tell you what has been confirmed and what has not been confirmed. But the federal government has made clear that we will not know for sure what these numbers are until we are notified in that week. A few days before we get them, we will get a number. And we will know that those are in fact coming. It is our understanding, again, this is subject to change, subject to shipment, and we're just trying to provide people of Ohio the best information we can at this point. It is subject to change. Pfizer, on or about, if this is approved, if this is all approved, we would anticipate around December 15th, there will be a shipment that comes out. On that shipment, 9,750 will go to our hospitals. This will be the vaccine that's pre-positioned. In that shipment, you will have 88,725 that will go to Walgreens and CVS to go to congregate care settings, basically in that first phase of the nursing homes. On December 22nd, we have confirmation of 201,000 from Moderna. That will go to hospitals. 98 hospitals have been signed up, 108 health departments. Hospitals will obviously work at vaccinating those who are dealing with COVID patients. Health departments will distribute this to people like EMS. They will vaccinate people who are EMS, home health care workers, for example. And those, there will be more examples, but those will go to, as I said, to hospitals and health departments. On that same day, we have a tentative number for Pfizer that we're seeking some confirmation on, but that number is 123,000. That number is 123,000 on December 22nd. Those, will continue to go then through Walgreens and CVS, and those will go directly. They will be vaccinating people in nursing homes and staff. Going to next date, a few days later, it will be another 148, we believe, coming from Pfizer, 148,000, and 89 from Moderna. So that's what the month looks like. Again, the second and third shipment from Pfizer has not been confirmed. We've got those amounts tentative, but they have not been, at least at this moment, confirmed. Let me now go to Dr. Joe Castaldo, asking him to join us and really talk about vaccines, why they're important to our work to eradicate the virus. He's Ohio Health's Medical Director for Infectious Diseases, Medical Director of Quality and Safety for Riverside Methodist Hospital. Doctor, thank you very much for being with us.
Thank you, Governor DeWine. As you know, in Ohio, we remain in a world war against a ruthless enemy, the coronavirus causing COVID-19. Thus far, we have a few weapons. We know that mitigation strategies like wearing a mask and limiting your exposure to people outside of your household help prevent infection. In the hospital, we have two useful medications to use in patients who have COVID-19, remdesivir and steroids. Soon, as you previously stated, we are likely to have another major weapon against defeating this virus, vaccines. Having an effective vaccine and vaccination program will be the first major step in getting us back to a pre-COVID way of life. Preliminary data from both the Pfizer and Moderna vaccines suggests that the vaccines are about 95% effective. What does that mean? It means that receiving a vaccine will prevent people from getting ill. It means receiving a vaccine will keep people out of the hospital. And it means receiving a vaccine will save lives. I'd like to make a few comments about the information we know about the two vaccine candidates from Pfizer and Moderna. Collectively, both trials prioritize safety and the highest scientific testing methods. Together, both studies have enrolled about 75,000 people from diverse populations. On December 10th, Pfizer will have their data reviewed at the FDA by a group of independent, non-government employed scientists, physicians, vaccinologists, and other top experts in their field. The data is going to be reviewed with a fine-tooth comb. No stone will be left unturned. Next, after a hopeful FDA approval, it then goes to another group of independent experts and scientists at the CDC's Advisory Committee on Immunization Practices for review and vaccine recommendations. Both review meetings at the FDA and CDC are open to the public. In addition, at the CDC meeting, major medical societies will have representation at the table for review and discussion of the data. After a transparent FDA approval and CDC recommendation, a vaccine will become available for Americans to receive. As a person of science, as an infectious disease physician, and a formal pharmacist, I have the utmost confidence in the outlined review process. When a COVID vaccine is FDA approved and CDC recommended, I will be rolling up my sleeves sometime, hopefully in the near future. I will recommend this vaccine to my parents, to my family, my friends, and to most importantly, my patients.
Doctor, thank you very much for giving us a description of kind of how this process works. I know some people have said, gee, this process was quick. This happened faster. Should that worry us? Is there anything about that that should worry us? And why is it fast? Why has it been able to be faster?
That's a great question, Governor DeWine. So back in the spring, the federal government introduced Operation Warp Speed as coming up with a more efficient way to get a vaccine out there, knowing that we are in a pandemic. What I could tell you is the way the studies are done for approval of these vaccines is the exact same way that we have done it with previous vaccines. We're doing it in a more efficient way that does not compromise any of the safety. In addition to that, the review processes that I outlined through independent groups within the FDA and the CDC are completely the same way we have done it for years by two independent groups of experts in their fields. Both of these open reviews at the FDA and CDC are open to the public. For me, it's going to be must-see television. I will be listening to those. I'm going to be looking at all of the details of the study.
Okay. Thank you very much. We appreciate it, Doctor. Thanks for coming on and helping us understand. And I'm sure that the news is going to be filled with this over the next week or so, and people are going to have the opportunity to just turn their TV on and watch some of this. And you said actually these are public meetings. Is that right?
That's correct, Governor DeWine. Both the FDA and CDC's meetings for review are open to the public. And again, I will be watching them. I think it's very important for people to understand the science and the safety of the vaccines. Yes, vaccines will help save lives, but we have to have a vaccination program. People have to choose to be vaccinated. I will say this, I'm almost giddy about having vaccines because I've been talking about COVID now for almost a year, and I want to talk about other things and infectious diseases. And having a vaccine be accepted is the first big step we have to get us to herd immunity in a pre-COVID way of life.
Thank you, Doctor. As you look at this and based on what you have read, what you have heard, side effects from this, if I take this, someone takes it, what kind of side effects would they expect?
Thank you, Governor DeWine. That's a good question. So keep in mind, all the information we have is preliminary data, and it's going to be reviewed, like I said, with a fine-tooth comb at the FDA and CDC. What's being reported so far is people may have a sore arm, or they may have a headache. What's important for people to realize is that when you get a vaccine, we want your immune system to become stimulated. So you develop immunity to the vaccine. So it's not going to be uncommon for people to feel off kilter for 24 hours. They may have a headache, they may have fatigue. That's not a toxicity, that's your body's way of responding to your injection and developing immunity and protection to this virus.
Doctor, thank you. Dr. Castaldo, thank you for doing this. I'm sure you're going to keep us informed. If you see anything, we'll have you back. Anything you want to tell us.
Thank you, Governor DeWine.
Thank you, Doctor. Appreciate it very, very much. We're ready to go to questions.
Governor, first question today is from John London at WLWT in Cincinnati.
John.
Hi, Governor. There are those who say you've shown remarkable restraint this fall, and there are others who believe you've not acted forcefully enough. The spring lockdown flattened the curve. This fall surge is getting worse, and clearly there's a percentage of Ohioans ignoring requests to wear masks and not gather. Would you clearly lay out to the state right now what you are willing and not willing to do as we move through December and the winter months?
Well, There's good news and there's bad news. The good news is we have more people in retail settings. We know because we're counting them. We know we have more people who are wearing masks, and it's throughout the state of Ohio. And the last survey that we did, I haven't got it from yesterday, but we were at about 91%. So that is a marked improvement. We also think that we saw over Thanksgiving a slowdown, not huge, but a slowdown from the previous Thanksgiving as far as people's movements. And that comes from data that anybody can look up on the internet. We saw the same thing in regard to the Friday after Thanksgiving, but Thanksgiving did occur. And, it could be that the cases that we're seeing today, we may be starting to see those cases. It's probably going to see it more in the next few days as we go out. We're only, now 8 days away, 7 days away from that Friday. So we could be seeing that continue, that spike up even further. If you look at the cases today, certainly not good. What we would hope is we would see a plateau. We're not really seeing a plateau yet. And then we really need it to go down. Look, we're having discussions. I was on the phone with infectious disease doctors, as I told you all the other night. We're consulting other experts. I'm talking to Speaker and Senate President right after this press conference. I'm talking to other members of the legislature. So we are in a very, very, tenuous, dangerous situation. And what I think everyone should be able to agree on is that we cannot let our hospitals get to the point where healthcare is dramatically threatened. So we are not going in the right direction. We think some of the things that we've done, the curfew, the additional mask wearing, the inspection of retail, we think these things have helped, but they've not clearly, John, they have not helped enough. And we are going to have to do more. And we're in discussions now, trying to get the best advice, best experts, but we're going to have to do more. We don't have any choice.
Next question is from John Reed at Gongwer News Service.
Good afternoon, Governor.
John.
Is there any priority for people who might be a caregiver for a loved one who's vulnerable and getting the vaccine? Maybe someone taking care of an older parent, something like that.
Yeah, I'm going to go, Dr. Vanderhoff. I don't know whether you're still on there or not. You want to take that?
So thank you. It's a very good question, and it really points to some of the subsequent phases of the tiering of this vaccine distribution. This first tier is really targeted to the people who every day are facing the highest exposure and